Hey guys, um, I'd like to introduce myself. My name's Daniel and I have multiple myeloma. It's a blood-borne cancer and it eats its way into your bones, into your plasma cells, and chews holes in your bones on the way out. I've been fighting this now for 4 years and I'm starting to run towards the end now, where there's less and less treatment options. But I will never give up. I'll never give in. I really don't know how to stop fighting, to be honest. That's all I've done for the 4 years. There's been a lot of pain and heartache and drugs that, man, they really hurt you. They don't tell you about further down the line, years down the line, when the side effects come and start kicking in, and as you get older they start to pronounce themselves, and they can make life pretty miserable, pretty horrible, to be frank. The reason that I've chipped in with my wife's gift to me of a legacy channel on YouTube is because I know that there are others out there that suffer this just as much or as more as I do. And as I've grown and learned and been through some of the things that I've been through in this journey of mine with my wife, I've learned a lot of stuff, and I'd like to be able to pass on some of that stuff to those who need it. I know that there's a lot of information out there. If I can help in some way, if I can make someone's day just a little bit better, it'll make me feel a whole lot better that I've helped. Service is where it's at for me now, and I'd like to be able to give back a lot of the stuff that I've been given. I have a lot of friends who have backed me to the hilt. They've prayed for me, they've sent me gifts, they contact me and let me know that they've got my back, and that's a luxury that some people don't have. So if I can help anybody out there that has multiple myeloma, give me a holler, drop me a DM, drop me a message, talk to me. I'd have a look at some of my videos that are going to be coming up. I'm going to be doing some tips and tricks and stuff that I've learnt in the 4 years that I've had this crappy disease, and maybe it'll help you, maybe it won't, but I'll tell you what, we're going to have a laugh along the way. Thanks for listening, and I'll catch you flip side. Chirp. Not every day is as good as the next, and some days are really crap. Today I had to go in and get the jabs for my bones and for the treatment, the monoclonal immunotherapy that I'm on. And whereas with the previous immunotherapy course I was on, Within 2 hours or so it would kick in hard, and you could feel it just running through your bones and through your system. And it was about 6 to 8 hours of being in pain, and then it was sort of done, and you managed to get by the next day and start muddling around. But this one it's much stronger, and it doesn't kick in for about 5 or 6 hours, and when it does, it hits you like a frickin' freight train, and every joint and bone and broken bone hurts, and hurts a lot. So you end up feeling pretty damn miserable for a bit of a while. It's very hard to explain to people that haven't endured cancer what the levels of pain can be like, and it can get pretty bad, and it can really mess with the mind. And it's taken me quite some time to get my body to a place where I can deal with pain a whole heap better and keep my mind relatively intact. It's not something that I like to talk about too often, because otherwise you just constantly feel that you're talking about and enveloped in this cocoon of pain, and it just goes on and on and on and on and on, unless you start to push through it. And pushing through it can be really hard, but it can be done, and it's a matter of choice, and it's a matter of getting yourself to the point where you're able to say to yourself, yep, I'm getting up, I'm going to have a cup of coffee, and I'm going to go and do something productive. And it doesn't have to be something huge. It can be anything at all, as long as you feel that it's productive and that you've done something useful. It goes a long way to keeping your brain away from the black dog, from depression and anxiety. So anyway, I just wanted to share that quickly with you guys, and I'm hurting pretty bad right now, so I'll go and do some doom scrolling and go through some movies maybe, because with the jabs and the medications, you get a very high dose of dexamethasone, which is a steroid, and pretty hard to sleep on that first night, if you can get to sleep at all. So we'll see how it goes, and I thank you all for listening, and I will catch up with you on the next video. Take care, and love to you all.